Well, hello, everyone. Welcome to IDM Scholar Society Study Club. Dr. Gina, we have an amazing group with us. We're going to be going through and talking about really tonight is a little bit of my secret, I'm going to say, to a lot of our outcomes, that secret that I've shared with you, Dr. Pritchard, on how we get amazing outcomes not only on the dental side, but even in your medical practice. So before I introduce them, anything you'd like to say to welcome everybody?
Well, I just want to reiterate what you have just already said, the fact that the topics tonight that we're going to talk about, we've seen, as you said, amazing results in our patients. And the thing that I love about that is, first, we started with the science, like what is happening in these companies that we're getting ready to talk about tonight? What science is behind the ingredients that are in their products? How could that relate to what we're seeing in our patients' health and in our patients' lab work and our patients' saliva results? And so it's been amazing to me to go on this journey with you and see every year, I think we get better and better at improving our patients' health using these three companies' products. That's for sure. We couldn't do it without it.
Absolutely. So before I'm going to show some before and afters to kind of kick us off, I do want to share just a little tidbit of my personal life. People always ask, like, how did you meet these people? How did you get involved? And I always think it's like a little tidbit. I have to start with Deb Bridges over there. She has just become one of my dearest friends. And honestly, we should not have been friends. Like, my husband had left a job and this person took over, right? Talk about like mortal enemy. And I sat down to just have a snack with her. Like, okay, I'm going to be nice. You know how that is. Like, professionally, going to be nice. Lo and behold, like 15 minutes later, she's like hugging me, kissing me. We're like new best friends. So, people come into your life. We say it all the time. It's just like, right. We always have to keep an open mind. And Deb, you are one of those people for me of like, right. I could have avoided her, but instead it was like, hey, I know you. Oh, you know me, not like in person, but now we do. And fast and furious friends we did. And then we have Liz Laundry, who is just an amazing hygienist in my colleague group. I can't say enough from being part of JMP Institute, training, helping hygienists, and then really being part of Cell Life. And one of the times that I think I really got to know you is we were on an AOSH hygiene panel. And so we got to like see what we were presenting. And I was like, oh my God, she's one of my people. Like, she's speaking my language, talking about just science and ingredients, and we just instantly connected. So I'm so happy you're here tonight, Liz. And then Dr. Haas, we had kind of a instant moment. I was actually telling my husband who's in the industry, oh my gosh, you got to come learn about this product. I want to show you this product, blah, blah, blah. I was so excited. And then lo and behold, they're like, oh my gosh, almost they're like family friends. Like, you're him? Oh my God, I'm best friends with him. Like, he's like my brother. And I'm like, 2 minutes later, right? I'm not even in the conversation, but I just have to share that because I have a personal moment with each one of them, and each one of their companies are just amazing. And I can't say it enough. People ask me all the time, what are the products or the things that you're using? And tonight is about that. I am sharing my secrets with all of you, my secret friends and the secrets. And I actually want to show you some before and afters. So let me just share my screen here real fast. And we're going to start with this first one. And really, it's not to walk through these cases necessarily. I just want to show you the power of testing and the power of these three products. And they're going to give you all the science behind it and the whys and the whats and the hows. But what I want you to see is this on your left-hand screen. This person was struggling at the end of 1023. You can see they had TF here, and you can look at the amounts. They had high PI if you follow down this orange zone, and some others there to follow. The thing is, this is actually a hygienist. I am just going to disclose this because this isn't a grunge mouth. This is no signs or symptoms. And you can see that she was making headway and she got that down to a 2, but she was still high in this orange zone over here. And adding in these products, I just want you to see what happened. Literally, she's now completely clear all the way down. This is the power of having the right products and understanding how to put them into use. And so the next one I want to show you is kind of a longer story, but you can see that they started again on your left. They had those real strong resistant strains. They did use some antibiotics and went through products and they cleared, but we wanted to get rid of that FN. This Dr. Gino is one of our patients that we just, we're always, can we do better? What's the best thing, right? Always looking for that. We then switched over to some of these newer products, our secret sauce that we have on tonight. And look at this. This person cleared again all the way down, getting rid of that FN and even FA there. And then you can see even at her 3 months, we went out even farther, sustaining that. So I just want you to see the power of these products put into use and their combinations, because they were using these products throughout and using that. Now, Dr. Gina, we have to get to our panel here and our speakers, but this case that I'm putting up here is really hard to follow, but I hope just your eyes are like, oh my gosh, there's a lot going on there. Yes, this is a patient from 2017 on your upper left, came in, then testing all the way through. You can see like 19, you go over to far right, 21. We just cannot clear these pathogens. We're getting better. And then he kind of falls off the bandwagon here. And you can see that we are getting worse. And here it's back. And then finally, we get him on the right stuff. We found out he wasn't using the things that we were asking, and boom, clears all the way down. So I just wanted to show that with everyone, let people know what's going on, why we want you to learn the science and learn how to implement these newer types of products so you can get the same results. So to kick us off, we're going to start with Deb Bridges. She is like our little nugget of why we're even having a symposium. Deb, you came up with the idea of, hey, let's do this whole totality of care symposium with IDM. So kick us off how you even came with that, and then take us into your Probiora Health.
Well, first of all, thank you. I am really honored and flattered to be with everybody on this panel. Have no idea how I was chosen, but I'm incredibly grateful. I'm going to start with why my background might look so bad. I had a horrible power outage. Electric poles came down right outside of my property today. Things were blowing up. Fortunately, nothing in the house, but I still don't have power. So my apologies if I am like my background is pretty dark. So I'm making lemonade out of lemons, as one of our dear friends, Karen Davis, would say. So at any rate, when I first met Laura, so I don't know, fast forward just a little bit, and then I'm going to back up a little bit. Laura said, why didn't you lead with what you did in the business? Because I introduced the slimline insert with Dentsply. So unless you're under a rock, most people know in this dental industry, the slimline insert. So developer, inventor invented it, and then we perfected it together with mutual friends of ours. Some of you know Noelle Paschke, some know her husband, Rich Paschke. Most would know Noelle if you mention her name. So anyhow, working with him to complete all of this and make the instrument what it should be. And Laura said, why didn't you lead with that? I never would have not liked you. So there was never like a question as it relates to her husband and what he did with Probiora and now, and that is who I am with, Probiora Health. It is an oral care probiotic company. But how this whole symposium idea came to be was in going to different seminars and listening to people talk about the theory of integration of medical and dental. But there was no, as I called Laura that night, she told me to call her throughout this particular seminar I was at and give me her opinion. Shame for her, because I called her even at 10 o'clock at night. So about 4 times that day, because I was super frustrated in listening to these conversations going on, but the confusion about how to implement the steps behind what to take in terms of this integrative health between medical and dental. And I said, it's missing. These connect the dots steps, they're missing, they're disjointed. People don't know, do I have to implement 37 steps? Well, that's a fortune, and that's not what I went to school for. So how do I do all this? So we started talking in earnest, and then it came up with the dean at Lincoln Memorial University in concert with IDMSS that we should have an IDMSS symposium at LMU, which is what we are doing in May. It's the middle of May. 17th is student day, and the 18th and 19th is for dentists, MDs, and faculty to join us, and deans of hopefully other schools. So there's a real impetus between IDEA, which I serve on the board of the corporate council with IDEA, and with ADA. The term and the new buzzword is integrative health. Well, I call it new buzzword because it's been around forever in other industries and on the medical side, but we do such a poor job on the dental side of what does that really mean? We're still going to sit somebody in a chair, forgive the vernacular, making it simple. We're going to prep them. We're going to drill them. We're going to fill them. We could extract, and we're going to scrape without ever considering all that stuff that's getting into the bloodstream. So I'm very animated when I speak. I'm sorry, but I'm very passionate about this subject because it's near and dear to my heart. We've been talking about this way too long, and it finally should come to fruition. So hence we trademarked the name Totality of Care, and the symposium is centered around that totality of care model. And what does that mean? Well, the three of us on this line tonight, that are the speakers anyway, are a complete package when it comes to Laura saying she finally figured out the secret sauce. This is her secret sauce. So I always say it's a collaboration, a village. It takes a village everywhere in life, in business. I believe that. So we do things incredibly well on a probiotic side, and I'll share my screen in a moment. Because I don't want to take all my time from pumping up this symposium, which we're really excited about, by the way, if you can't tell. But the other thing that's incredible about this is in conjunction with Stella Life and Supermouth products, we now have the ability to knock down more than 3 or 4 pathogens. We can knock down a whole lot more, as Laura showed in her slide. And she's just on the cusp of doing those studies. And just imagine once this stuff gets published and out there about this dynamic trio that I call things the triad. Laura, Gina, and Ann Rice are like my triads. So there's a story behind that. So I'm full of them. So I'll just eliminate that one tonight. But what's exciting is that we're finally starting to pull off this integration between these modalities of care, and for dentists and hygienists to do better, be better, and be more and have their patients more informed as to why we might not treat you today, because it might not be the best move for you today to do that without getting into a little bit more of the history and everything. So again, I'm incredibly grateful to be here. The symposium, again, in conjunction with LMU, is being held May 17th. That's for students, and then 18th and 19th for faculty, as well as dentists and MDs as well. And LMU has a 400-seat Doctor of Osteopathic Medicine school. So hopefully, finally, more students on the medical side will get exposed to these concepts and be at least open to adding these kinds of conversations in with their patient care models, which is what we can hope for. So as we get more and more into the studies, I'm really excited. I'm going to pair Laura up with the molecular biologist, who's pretty outstanding, that we know really well. And what's awesome is that when the triad has presented, as I mentioned, that's Laura, Gina, and Ann Rice. And I should call her Dr. Gina. Sorry, Gina, for being so informal. But it's really about this totality of care. And I showed, and I'm going to show tonight again for the first time here, the slide on the different strains of bacterium products. So it's not a focus on the product by a manufacturer name. It's the strains of bacteria that are in those products that make it germane to what it's going to do and what you're targeting for that health of the patient. Laura, did I pretty much cover that, or are you ready and I can share my screen?
Yeah,
Any
go
other
ahead.
questions, anything you want to say or have me add?
No, let's take a look.
All right. If we pull this off, it will be great. Okay. All right. Please tell me you can see my screen. No.
You
Okay.
see your,
Whoa.
There you go.
Where did it go? Can you see it now? I can't see it. That's funny. Okay.
you can't see your slides. I can't. Do you all see your slides?
Not
yet.
yet.
Us.
Huh. I'm going to stop sharing and try it one more time. Sorry, everybody.
Hit for a second at the bottom. They were at the bottom. If that's helpful. See them at the bottom?
Yep.
Yeah.
They're on now.
Perfect. Okay, so again, I'm with ProBior Health, and again, I don't want this to be an advertorial, although we have this beneficial byproduct, if you will, of our formulation that again coexists and cohabitates with all of the other players on this call quite well, as was already mentioned. But how ProBiora started was about 35 plus years ago. Dr. Jeffrey Hillman out of Boston's Dental Forsyth Institute, a Harvard grad, deduced, well, if we all have detrimental bacteria, why doesn't everyone have a propensity for caries and for periodontal disease? So those were the hypotheses that he had, like, why not? And what is in every healthy mouth? Well, it distilled down after slurring many, many Petri dishes and examining oral cavities for what is present in healthy mouths versus not, that it distilled down to 3 bacterial strains. We like to say it's powered by ProBiora 3. That patented probiotic blend, includes a strain of Radis. So Radis competes for space with S mutans, kind of kicks their butts, get them out of the way. I speak in martial arts terms too, and it doesn't produce lactic acid, meaning these S mutans that like to transform into the sticky substance, lactic acid, can't bind to your tooth surfaces. And over time, it also will balance the oral pH. And I get asked, well, how long over time? Well, it could be 30 to 90 days, depending on the oral health of the patient, the specific patient. And then the other 2 strains, and these are all strep strains, but they're great strep strains, are Oralis and Uberis. And these produce low levels of hydrogen peroxide. What that does is it's a mild, a low dose hydrogen peroxide release. There's your antimicrobial, but it also adds to whitening your teeth 2 to 3 shades. So not a professional whitening, but by any means. And I always use me as an example. Yes, a study of one doesn't make it right, but when you're looking at coating the tubules of the tooth, byproduct is it decreased my sensitivity now by 98%, about 5-6 months into taking the product and being a religious user of the product. And that was 1 a night. That's what we do. That's what we recommend. It literally reduced my sensitivity by over 50%. Now I'm probably 98, 99%. And this is over a period of 3+ years. So just so everyone has it in perspective, and then I speak the truth. And then, so these are the 3 proprietary strains, as I mentioned, that are very effective. So for someone with hypersensitivity like me, over etched as a kid for bracketing, what did I know then as a kid that I know today? And then I have all these striations in my enamel. So I am not a candidate for whitening, a professional whitening. I would rather have a root canal without anesthetic than have a professional whitening treatment. So for me, that should make most of you cringe and turn up your face. If it did, that's exactly what it was meant to do. That's exactly what I feel about professional whitening treatments for me. So they don't work. So for me to have my teeth whitened naturally by 2 to 3 shades is a big deal. And now when we get into the strains and what is in our other products, again, this isn't meant to badmouth any particular product on the market. What it is meant to do is show the science that's in the product and let the science point to what you're going to add to a patient's regimen. So know what you're treating, I like to say, and then pick the product that's in addition to Probiora, not a substitution. I always say we're not a substitution. But if you're going for throat and gut, and you have tonsil stones, for example, I heard more about them in 2022 than I ever care to remember or recall in my entire career in this crazy business. So bliss strains are what you want to pick. Something with a bliss strain. They target the throat. They do incredibly well with the tonsils, with tonsil stones, as I said, anything to do with the salivary glands. You pick a bliss product and add that to the Probiora strains, and you have like an amazing concept, right? This totality again of treating the oral cavity. When it comes to L-reuteri, one of the largest suppliers there, again, not bad mouthing anyone, it treats the gut. And when you look at, which is kind of hidden, there's a story, there's a study down here because I got called out a lot by the team of professional educators that I handle or manage, if you will, that I didn't add, and we did not add gums to this gut strain and gums when it comes to L-reuteri. And the reason that our molecular biologist likes to keep me more like incredibly honest, and I like to believe that I am already, and better at what I do. Between her and Laura, I think I'm better at what I do. So I'm just incredibly grateful for the relationships that I have with both of these individuals, with Gina as well, and what I've learned from her. So at any rate, there's a study and a link that refutes the, I call it substantivity of having L-reuteri as a product that targets gum health, because L-reuteri doesn't have substantivity. For those that might not be familiar, it's kind of like minus the negative side effects of chlorhexidine. Every 20, 30 minutes, you have to keep repopulating with that particular product, or it's rendered ineffective. So all of this circles around, and I'm kind of running out of time, I believe, although I can't see anybody because I have my screen full. Poor oral health and gingivitis, periodontal disease contributes to overall health. We on this call are probably way ahead of our fellow peers and colleagues in understanding this. But I wanted to wrap up tonight showing everything that happens from abnormal pregnancies and outcomes, cancer, diabetes, and there are many anecdotal studies we have and more studies, IRB studies that are currently underway or getting underway utilizing our product. But again, if we're not salivary diagnostic testing the only missing link here tonight, and then using these products that are so synergistic and compatible with each other, not to the preclusion of one, or you pick them and then not us, or any of the other products that are going to be talked about tonight, it is incredibly synergistic. And the more we get behind that belief, the better off we are in the totality of the patient care. So I'm going to stop sharing my screen and I will open it up. Laura, do you want questions at the end or now, or how do you want to do that?
Yeah, we're going to take questions in the end. If you have a burning question, you can drop it in the chat. We'll get back to it. We're moderating that. But just appreciate you showing that, educating us on probiotics. And like I said at the beginning, these are like the 3 staple products that I feel every dental practice should have. And thank you for kicking it off for us with Probiora Pro Health, because right, it's one of the top strains that I talk about when we have those red complex or very aggressive strains. It's just absolutely phenomenal with that. But we can't ignore what we'll talk about at the end with Liz and her probiotics. We're going to show how those work together. But before that, I can't wait to introduce you here to Dr. Haas, who is creating super mouths across the country. And just with your product, I've just seen such phenomenal results. I think that's what has wowed us and why we really can't say enough too with bringing it in is just the synergy that it creates with what I'm going to say a healthy product, right? A lot of times we want to move away from these harsh chemicals, but we can't always get the results. And so I think that's what's great about all of these, what I call foundational products. But a lot of times people are looking for those everyday product of like, well, what toothpaste, what mouthwash, what do I use? So I'm going to turn over you to Dr. Haas. Introduce everyone to Supermouth.
Well, great. Thank you so much, Laura. This was such a wonderful introduction. Nice to meet everybody. Nice to see most of you, some of you. Just a quick background on me. I'm actually by profession, I'm an orthodontist. My wife is a pediatric dentist. So it's kind of surprises sometimes people when they find out now I run an oral care product company. They're like, what does ortho has to do with that? So it really has nothing to do with it. But the story is 12 years ago, my son, I was just talking to my team, my colleagues here, that my son is turning 12 and he's going through puberty. And when he was born, even though by then my wife and I, we have the largest group practice here in Southern California with a ton of pediatric dentists, general dentists, hygienists, orthodontists. And so you would think we would know everything we need to know about toothpaste and mouthwash and floss and toothbrushes. But as you all know, it's a secret to, I think, the public, but we all know that we don't learn about that in dental school. We don't learn it in medical school. We don't learn it in hygiene school. We don't learn it in residencies. We don't know what's in a toothpaste. So the first 20 years of my practice, when a patient would ask me, what toothpaste do you use? I said, just use anything with fluoride. And they would say, which one? I'm like, doesn't matter. And then when my son was born, the first few teeth that started coming in, I went to my wife and like, what toothpaste should we use for? And this is 20 years into our practice. And she said, I don't know. And if it was the first time that I actually went and Googled, like, what are all these ingredients? Is fluoride safe? What is there an alternative to it? And so it was like the beginning of, because I really needed to know now what toothpaste is actually safe and effective. Like Laura said, I think the misconception, I think there's people either use conventional thinking is completely unsafe, or they use something that says natural without knowing any of the ingredients, thinking every natural thing is safe and effective, which of course is not. A good example is cocaine. This is a good example. Cocaine is natural, but it's completely unsafe and I would say ineffective for oral care products. So we really want to look at every ingredient, every product. And so this was the beginning of our company, Supermouth. And we decided, hey, at this stage, I get together with some really key leaders in industry of medicine and dentistry and research. And we said, if we're going to fix oral care, the number one disease in the world is dental disease, right? The most common chronic disease among kids is dental disease, which means whatever we've been doing with our toothpaste and mouthwash and floss and toothbrushes is just not working. And there's no science because nobody's learning yet. So we need to do this from the scientific side. We need to do this on the education side. And we need to create all the products necessary for all the risk factors. When I go to interviews, sometimes I get this question, Dr. Haas, what toothpaste do you recommend? And I usually say, well, let me ask you a question. If you're a pregnant mother with a 2-year-old who gets no cavities and a 10-year-old with a ton of cavities and a teenager who just got braces and has a soda habit, you get the same toothpaste? And they say, probably not. And I said, that's why you really can't really just ask me what toothpaste. We need to customize it based on age and risk factors and all of that. But it's really difficult to do that, to go on Amazon or go to Costco and buy these products based on these customizations. So that's what really is behind our company. And I'm happy to share that with you on how that works. Okay, so basically, so Supermouth is, we have, just to quickly give you an idea, we have over 200 products. And the reason we have so many products is because we decided if we're going to launch it, we don't want to be a toothpaste company or a mouthwash company or floss or we want to be a oral health solution company. And to do that, we needed to have all the solutions for every single person throughout the journey of their life. And with different risk factors and different preferences, we need to meet those needs. And so we basically divide our 200 products. And by the way, we really try to be innovative. We have close to 300 patents, and that I'm not just trying to brag. I'm just sharing this with you to tell you, we really try to innovate and be the best in each category, from safety, efficacy, fun factor, utilization, unity, how they work together, etc. So we divide our products into 6 developmental stages. We call them 4 ages and 2 stages. The stages of pregnancy and orthodontics. As you can imagine, they would probably require something differently. I'll give you just one quick example. Our flosses for ortho have a threader built into them. They have a thicker floss, so it can not only clean between the teeth, but around the brackets where you get the higher risk of decalcification. But they all obviously have the same safety thing. We have no Teflon on it. There's no petroleum-based waxes like microcrystalline. Again, on the safety side, it's across the board. And all of our flosses are infused with all of our key toothpaste ingredients like xylitol, and we have a patented ingredient called hydroxamine, which is nanohydroxyapatite plus vitamin K2, D3, et cetera. So pregnancy systems, orthodontic systems, then we divide the developmental stages into 4 stages. Teething, which is very critical. This group, we don't need to talk a lot about oral microbiome, but during the first 2 or 3 years, the oral microbiome is predominantly developing and maturing. So it's really critical to start things off correctly. And so instead of using antibiotics in oral care products on a daily basis, we like to use prebiotics. We follow the nature, like breast milk, arguably being the most complete food. As you probably know, the 3rd most abundant ingredient in breast milk is prebiotics, or HMOs. And so nature gives it to the baby from day 1 to promote a healthy oral and gut microbiome, as also nourishing the cells. And we do the same thing. So we use inulin, we use xylitol, we use other prebiotics. And we're a big fan of hydroxyapatite, especially nanohydroxyapatite. So we do have them across board. We do have fluoride products for those dentists and those higher risk patients that they want to choose it. But even those types of products, we include hydroxyapatite with it. Anyway, so that's another ingredient. But we have all the other fun stuff. The toothpaste tastes like ice cream, and try to build positive associations with oral care, as you get older, 2 to 5 year olds, primary dentition, 6 to 12 year olds, transition, and mixed dentition. And then we have a full line of oral care products for teens and adults. Really revolutionary products. We have we've reinvented the toothbrush after 86 years, and we're really excited to launch that in about a month. Just to give you an idea what that's going to look like is the current toothbrush bristles were designed 86 years ago in 1938, right before World War II, which was like a little oval or rectangle, which doesn't resemble any tooth. And so the way we did it, we actually went out and scanned thousands of adult teeth, and then we scanned thousands of primary teeth, and then we scanned thousands of teeth with braces. And then we actually cut the bristles to contour around the teeth perfectly. And then we use nano bristles, so we can have the incredibly soft bristles, but we packed it 3 to 4 times more bristles than a typical toothbrush. And then from safety, from cleanliness, we have an incredible design with the UV system, et cetera, and that's getting launched in a couple of months. We'll share that with. But currently, we have over 200 products already on our website. So our products, we say they're super to make it easy to remember: safe, unified, playful, effective, reputable. I'll just quickly go through those. This is not ours. This is like other companies' oral ingredients, but just these are typical product ingredients in oral care. Artificial preservatives, artificial colors. Titanium dioxide is very commonly used to make the toothpaste itself white. And the concern list, by the way, this is not my list. There's just, I think, a lot of misconception or a lot of bias, I guess, in any industry, including oral health. And so we rely on an unbiased source called Environmental Working Group. I'm sure a lot of you are familiar with it. So if you go to ewg.org, any ingredient you want to use in your toothpaste, mouthwash, shampoo, anything, any oral care product or self-care product, you can put the ingredient, and it'll rank the ingredient based on from 1 to 10, 1 the safest, 10 the most toxic, based on just thousands of studies that they have access to, and then they actually list out the concerns. So these are just some little examples of those. We could go on and on, but the funny thing I just want to bring up is the 2 ingredients that usually people bring up to me when they're concerned about ingredients are fluoride and SLS. But out of all those bad ingredients, SLS is only a 2, which is still bad because everything should be really as close to 1 one really as possible. And fluoride is also two. The only reason I say that is because there's ingredients that are a lot more worse than those from safety, and nobody knows about it just because people only have heard SLS and fluoride. So that's a really, really invaluable source for those of you who want an unbiased source for safety. Okay. And we have, again, dozens of ingredients. This is just a quick list, but we don't have any artificial ingredients whatsoever. We don't have SLS. No, we don't use antibiotics in toothpaste on a daily basis. Everything that we have, we source it on it as a non-GMO source. And again, no Teflon, no PTFE, no chemicals. And so we're natural, but we're actually a natural company that actually works, and we have ingredients that are effective. The other one is unified. I'm always surprised how people use products that they do the exact opposite. I was on an interview, and this gentleman called me and he said, "Hey, Dr. Haas, I use Listerine and then I use probiotics. Am I doing everything right on a daily basis?" I said, "Well, I don't know. What do you think your Listerine does?" And he said, "Well, I think it kills 99% of my germs." And I said, "What do you think probiotics is?" It's like, "Well, yeah, that's just microbes." So I feel like we need to have oral care products that are working together, not against each other. And the ingredients were selected, so the toothpaste and the mouthwash and the floss, they all support each other. So that's what we've kind of gone out and designed so many products that hopefully work together as a unified system. The way our patients, our customers can buy it, they can buy products individually, they can buy it as a system, we call it, and then they can buy it individually one time, or they can buy it on a subscription. And I'll explain in a minute how this works, because we primarily work through and we sell through doctors' offices primarily, or hygienists. And I'll explain that in a minute. So the other one is P, for kids especially, we really made it fun because we want to build positive associations from day one. We have movies, augmented reality, comic book, music. If you guys want to get a glimpse of what I'm talking about, if you have kids or grandkids, you can go to supermouth.com/play. And our movie there was in a major film festival. I promise you'll laugh, you'll cry, you'll floss before bedtime. That's our tagline. And for adults, we really innovative designs, gorgeous, beautiful products, very, very, futuristic features, because we want all of us to enjoy taking care of our mouths. We actually do it. It's really difficult in 15 minutes to discuss how our products are effective, but I think that's why I look.
Uh-oh, he's frozen on my end.
Laura, I was so appreciative that you went through those tests, because at the
Dr. Haas, we lost you there for a minute.
okay.
Dr. Haas, are you back on?
Let's see.
I lost you. We lost you for a minute. I know you were talking about the testing, and so repeat that.
Okay, no worries. I said I'm really happy that there are third parties like you, Laura, and you, Dr. Gino, that you test these to verify everything that we say. Because at the end of the day, if they're not effective, then we're wasting our time and money and the resources of our patients. So we want to make sure that these products work. So there are a lot of reasons our products work. First of all, like we don't provide a toothpaste. Let's just say so with a toothpaste that just has fluoride or hydroxyapatite, because that your mouth is more than enamel, as we all know. And so we try to have every single ingredient be counted for to take care of a specific area of the mouth. First of all, your teeth are very much alive on the inside. So we have nanohydroxyapatite plus vitamin K2 and D3 for the absorption of calcium, because 90% of the US population is deficient in those two vitamins. As you probably know, without those two vitamins, we can't get enough calcium in our teeth and our bones. That's an example. And we use prebiotics like inulin and xylitol, erythritol for the oral microbiome. We use MSM and vitamin C in a particular ratio because they're the most potent natural anti-inflammatories. And then every pH of every ingredient product we have is alkaline. For example, our pH of our mouthwash is 8.5 and mouth spray is 8.5 and toothpaste is 7.5, etc. So those are some examples of how our products, we try to make them very effective. And then the most important thing, probably even more important than oral health, is that we really, really study and consider oral health, systemic health connections when we're formulating our products, because at the end of the day, we want to have a healthy mouth, but we also want to have a healthy body as an extension. So again, yeah, I mean, all of us have really put our hearts into this company, because this is not we're not trying to sell a toothpaste. We're hoping what we want to accomplish at this stage of our life is make a difference finally in the oral health of our society. So the way it really works is, yes, we do sell directly to consumers, but our 90% of our business is actually through dentists, physicians, and hygienists. And we have a very unique model. You don't have to buy anything from us. In fact, 90% of doctors don't. You can, if you want some products, and sell it in your office as a wholesale, but the majority of our business model is we set you as a complimentary website, and we can do that in 5 minutes. We have several ones to work with. We have a CE course online. It's only like 90 minutes, an hour and a half, and you get a free CE. And you think of that 90-minute course, the 90-minute course that we all miss in dental school, about toothpaste and mouthwash and ingredients and everything else. And then you're ready to recommend Supermouth to your patients. They buy it from your website. We ship it on your behalf. You order it basically for them. And then we lock that patient or that customer to your practice for life. And then you get profit sharing. That's really all it is. It's a really easy way, no cost, no inventory way to really get recommended. And so we can really help each other, help our patients, and make a difference in our oral health and systemic health. Thank you very much.
Awesome. Thank you, Dr. Haas. I think you said some magical things. I had to put them in the chat because that's why we're all here together, is that I think, just like you said, we don't learn how to use things together because we don't even understand the chemical components, let alone the pathways that I always want to talk about, because my dental nerd brain wants to go there. But I love just the analogy that you gave between like Listerine and trying to put a probiotic in right after. Which really leads us then into, I know, Liz, you're going to take us right down that path because you share that commonality. That's how you and I kind of came together, is everything that Dr. Haas is talking about. I know one of our kind of passions was around like chlorhexidine. Like, why is it even out there? Not that I'm picking again on any one product, but it's just, gosh, it's 2024. Let's use better things. And Dr. Wilkerson is on here, so I want to say hi because he didn't introduce us today, but you know, his mantra has always been with Dr. Dawson, like a better way, to find a better way. And I think that's just what we're sharing with everyone. So Liz, launch us into Stella Life.
Thank you. Thank you so much. I'm having so much fun listening and learning, and I want to try all these products. I'm just really excited. And thank you for having me, Laura. And just want to bring this PowerPoint of mine up. I do have a bunch of slides. I want to get through a lot of information here and talk really fast. But I think that we have a wonderful synergy between what each of these companies offer, and there's a place for being able to really support our patients. I love the totality of care. And having been a hygienist since 1979, we didn't wear gloves or masks in those days, a long time ago. But seeing the development of the science, and we didn't even, we didn't know anything about biofilm in those years. So we've come such a long way. And I've had the pleasure of being on the panel with Laura and working with her and learning from her as well. So I'm just so happy to be able to share what I've learned with Stella Life, because it has been a life changer for me, as not just because I work with Stella Life, I'm the clinical education manager for Stella Life, but I've also been a consultant with the JP Institute, and I still do that, helping offices really put together the philosophy of the doctor, but integrating. We're really keen on really making sure that everybody's educated and understands the oral systemic link and how we impact that, and with our products, and also with the care that we give our patients and educating our patients. So that's always been my mission, and I've always liked a natural approach myself. So when I started learning about Stella Life and using it in my own practice as a hygienist, it was just so gratifying to have solutions for people for different conditions that we never really had anything that worked before. And also, having grown up in dentistry using chlorhexidine and all the chemicals and all the brand name toothpaste that you get by the case free when you're working in these offices. And so everyone distributes them. As we're learning more about what we're seeing happening with patients' health and what we can do, to really give that care, the totalitarian approach to patient care. So our mission, like I think everyone on this call, is to improve people's lives. And with Stella Life, we're doing this by providing safe disinfection without side effects, with products that are actually really pleasant to use, like all the other products we've heard about today as well. And we're just seeing more and more clinicians use them and having really terrific results. So we have an oral care line, and we have rinses, and yes, they do replace chlorhexidine without any of the toxicity, but they do so much more. And there's been a lot of research that's gone into this. As you can see, the company's just getting to be like 10 years old. I was there from the beginning, where there are only a handful of us. And through that time, especially during the pandemic, where there wasn't so much going on, and when I first started with Stella Life, the company was very small. So I actually took 800 calls Monday through Friday, 3.5 hours a day. And I got to be friends with a lot of people, some of these elderly people who, are not comfortable using the internet. So they would call to put in orders for their Stella Life. And I would hear their stories. I mean, we'd have these long conversations because there wasn't a whole lot going on during the pandemic. So we would talk, and I would hear about their lives. They would be telling me how, they had really bad problems with dry mouth or with lichen planus, and that they needed to get this order in because they were almost out of their Stella Life. And so I heard their own personal stories, and it would just feel so good to be able to provide comfort for people on many levels. So we're talking about not just our patients that have the dental needs, but patients that maybe are going through chemotherapy, patients going through radiation of the head or neck. When they use these products, particularly the recovery kit, before they start having their treatment and then supporting themselves with using the rinses throughout their treatment, they don't get the mucositis, they don't get the sores that they used to. They're able to swallow and nourish themselves. So with the rinse on as a standalone product, it does disinfect safely, but it also has many other applications. So when offices begin having Stella Life in their practice, we actually provide training for them, for the entire team, so they understand all the different applications of it. So the rinses, in addition to disinfecting, can be used for xerostomia. Those people that would call me, with the 800 numbers, and also my own patients that had dry mouth issues, would say this is the best product they've ever used. That's the feedback that I've gotten from so many. And it also treats the symptoms of lichen planus. It provides relief for people with pemphigoid. So there are just many, many different applications, not just disinfecting. With the gel, it is something that is used to provide pain relief. It provides analgesia within 2 to 3 minutes, but both all the products, the oral care products, also accelerate healing. And I'm going to be sharing the studies about that in just a bit. But so the gel will provide analgesia. It also accelerates healing. So when it's used, for example, on a canker sore, the patients will get out of pain with these after ulcers, which can be really, really painful, but they also will have that resolved in a couple of days rather than 10 to 14 days. So with the oral care line, the recovery kit, and some people call it the surgical kit, but again, has many applications. It has the rinse, and we try to keep everything as natural as possible. So we are finding that these products are not toxic. And again, they're very pleasant to use. We have a patent, a European patent, as well as a US patent, which we're quite proud of, because to get a patent on a natural product is not very common. So, that was just very, very happy to see that happen. And let me just share some of these studies with you. This study was done at Bern University, and as those of you on this call are probably not using some of these chemicals in your practice, because you're like, we're preaching to the choir, you're enlightened, you understand these connections. But as I'm trying to, Stella Life are educating the other people that are still using chlorhexidine, as I did, in the early part of my career. we really want to show what the difference is here. So in this study, chlorhexidine was compared to Stella Life, finding that there was a lot of toxicity with chlorhexidine. We know that it kills osteoblasts and fibroblasts. I say it kills the good, the bad, and the ugly. So it gets rid of not just the pathogens, but also the commensals, and it kills the cells that we need to actually grow so that people can heal. So what the study proved is there was no toxicity with Stella Life as compared to chlorhexidine, which was very toxic, but also demonstrated that the Stella Life rinse accelerates the growth of fibroblasts. So when you have that accelerated fibroblast growth, you're going to have more rapid collagen formation. And with surgical applications, we basically commonly see a month's worth of healing within a week. So this is the type of rapid healing that you'll see with Stella Life. In this study done at the University of Texas, they compared the Stella Life rinse to chlorhexidine to Listerine, as well as saline, finding some toxicity with all of those. And if you look at the scratch wound assay samples here, this is the Stella Life sample, and you can see here how the fibroblasts, this is a thick band of fibroblasts replicating very, very nicely. When you look at the chlorhexidine sample, there's nothing there because it's killed everything, the fibroblasts, the osteoblasts, and all those commensals. We have not been respecting the microbiome. We need to respect and nurture and love the microbiome. That's why we need to have the probiota. We need to have these all products, toothpaste that don't have the chemicals that are going to disrupt everything. So we want to encourage that growth. And when you look at the control, this is normal fibroblast activity, but you can see how much thicker that band is with the Stella Life sample. And here, this was published in the AAP Journal of Periodontology, and here they compared the gel to chlorhexidine, povidone iodine, and Sciences, finding toxicity with all of those other products. No toxicity with the Stella Life gel, but the gel also was found to accelerate fibroblast growth. So this study was just published in December at Rutgers and was really fascinating because here, with this team, they looked at the bacteriostatic activity of Stella Life because it is bactericidal against a number of pathogens, but it's also bacteriostatic. So we have FN in check for 12 hours after exposure. But when we look at P. gingivalis, 96 hours after treatment, we've got that one under control. And we all understand, the workings of P. gingivalis as a keystone pathogen, the effect it has on our overall health. So be able to do that is going to help, again, to encourage the health in the mouth and in the rest of the body. And that's what we're all after if we're looking at, this oral systemic link and what we can do to encourage that and support that. What this also showed was the lower toxicity toward the commensals. And that was something that we're so excited to see because we need to have that nice, healthy oral and gut microbiome. And unfortunately, we have not been doing that with a lot of the stuff we've been using in the past. So this was very exciting. And also, as a trainer with a JP Institute, I do hands-on with a hygienist, and I'm a laser certifier. We're doing all these different things, and we've always looked at biofilm as wow. It's so challenging to disrupt biofilm to keep it under control. And this study showed that Stella Life does actually disrupt biofilm. So that was really good news. And we still need to use our technology, I think, when working subjectively, but having anything that's going to add another layer of that to what we're already doing is great. As far as pain management goes, when these products are used in conjunction with any surgical procedure, we do get analgesia as well. So we can pretty much eliminate or hugely reduce the need for opioids. That's an epidemic. According to a recent course I took, the statistics show that 1 out of 10 people get exposed to opioids once and they become addicted. So we still need to really be very serious about that, of course. And this study was done with Doctors Lee and Suzuki with the recovery kits from Stella Life, which has the rinse, the gel, and a sublingual spray to get these ingredients systemic as well as topical and using the rinse. But it was used for patients undergoing block bone grafting, which you can see looks pretty painful and is considered the most painful procedure in dentistry. And they were really so happy, not just with the accelerated healing, but also with how comfortable the patients were. And you may know Dr. Suzuki, he was the previous chair of the dental products arm of the FDA. So we were just so happy that they did this study. So with using the recovery kit, that we really can hugely reduce and eliminate the need for opioids, basically using acetaminophen and ibuprofen, that basic combination. But with this, if you're doing any surgeries, you get less calls on the weekend, that people are in pain. And again, we can use these on so many different applications. So with that, seeing the need for opioids reduced is huge, and just giving our patients something pleasant to use that is comfortable. And this recovery kit has won the top oral care healing product from the Dental Advisor for 6 years in a row now. We just got an order for 2024 as well. So the microchem testing that we've done have found the other pathogens against which Stellife is effective, including strep mutans. So patients that have xerostomia have a higher caries risk. With one product, they can hydrate as well as reduce their caries risk. And a 2-minute rinse also will kill human coronavirus. So we're seeing more and more offices use Stellife as a pre-rinse as well. So again, no toxicity, very popular with pedo practices because a child can swallow this, not going to be a problem, safe for everybody to use. So again, with the recovery kit, ideally it's starting, the use is 3 days before a surgical procedure, or hygiene for diabetic patients or people who you expect are going to be having a lot of bleeding. When they use it preemptively, they have reduction of inflammation, they have analgesia already in place. There's a reduction of bleeding, so there's a clearer field on the day of the procedure. And with less bleeding, there's less swelling and bruising, so the patient is going to be more comfortable. So those products are used 3 times a day, starting 3 days before, ideally, same protocol the day of the procedure and for a week and a half afterwards as they're healing, so they can have safe disinfection and comfort as well. So these are just some cases before and after using the kit and also applying the gel at the end of the procedure. This patient had extractions and immediate implant placement, and you can see within 40 minutes of applying the gel, the reduction in inflammation and bleeding. And on the upper right, patient had a ridge augmentation and sinus lift, and the gel was just placed on the right side. So you can see the difference between the right and left side, which with a level of inflammation and bleeding. And the patient on the lower right had an extraction and bone grafting, and after a week got really great resolution with using that kit and did not need to take very many pain medication at all, many pills, no opioids. So with the this patient using having used steroids for her lichen planus was not getting relief, got a great result using the Stellife rinse and the gel. So again, another group of patients that we all have in our offices, and we can give them something. And with talking about the rinses, there's a case that we have on our website. One of my patients who had geographic tongue and used the coconut rinse, and after using that for 2 weeks, I got rid of the lesions and the sensitivity. And I haven't seen anything work for that before. So I was really excited about that. And then we do have our probiotics. We have a kit with a gut and oral probiotic together that includes also the prebiotics and postbiotics. The gut or a probiotic is a spore strain. So it survives the stomach acid, gets through to the gut where it does its job, does not need to be refrigerated. And again, there, as you saw in the chart earlier from Deb, it's a whole different set of strains. And again, when you look at the different products, there are different functions there. So again, it's a different product for the oral lozenge as compared to Probiora. And we really feel that there's a place, for these different applications, and no one product is going to work for everybody. And so I really love what I was learning about Probiora today. So I'm really excited to learn more. We also, because we're seeing more and more implants being placed, and that's just going to be a trend as more doctors are placing implants, we want to make sure that we get the best possible healing and bone integration. And we know from the research that if their vitamin D is low, you're not going to get that integration, and the implant failure rate grows up hugely. So if you go to our stellife.com website, you can see all of these studies and all the information that I've shared. But we know that we can help to provide the nutrients that patients need. And that's why we have Dentamedica as part of our catalog now. And there's experiences which you can see on our website. One of a periodontist that I work with who has Stellife in his practice had a patient who came in who'd had 2 implant failures, same tooth. And so found that she was low in D. So more and more offices are testing. He put her on the Dentamedica, and the implant then integrated, the one that he placed. So it has not just the D and the K, but also the other micronutrients and antioxidants that you need, all fully absorbed. And here's a QR code so you can go to the research page and learn more. But we do provide training. Our products, we do guarantee them. We even replace expired products. We don't want people to worry about trying the products. And we make sure that we help support them, the business as well as the clinical results. So just I'm happy to help you learn more about this, and we'll be open for any other questions. So I'll let you take it away, Laura.
Yes, thank you for that. We actually want to open up to the community. I think that this is just a big opportunity to have all three of these companies on at once. I hope that you're seeing the layering effect, and I'm going to have Dr. Gina and Dr. Wilkerson join me. But I think that's one of our strategies, right, Dr. Gina? We talk about a lot of time we're looking at the breathing, how it affects what Liz is saying, the healthy bacteria, right? We get a shift to then these very pathogenic species. And it's like, what are they eating? Can they even, sustain or even grow healthy species? Most of our patients don't even have the supporting structure or what I'm going to say supplementation going on, whether it's even from diet and food, or they're just so depleted. So let's take some questions, but Dr. Gina, I'd love for you to speak on that a little bit, because that's a big piece of why these products are in our repertoire, in our, I'm going to say, our toolbox.
Right. So I would elaborate on that simply by saying that when we first started working together, Laura, we didn't have the quality of products that we have available to us now. And so we had a lot of conversations around, why is our blood work not really looking any better? Why is inflammation not going down? Why are we not making a difference at the cellular level, which may sound boring to certainly the public and perhaps to many of us on this call, but we're very interested in the cellular downstream effect from everything going in the mouth, because it gets into the bloodstream and that's where plaque forms. And so implementing some of these strategies, understanding the work that had been put in to scientifically validate their not only beneficial effect, but lack of harmful effect on the inflammatory state, oxidative stress in the body, has been a game changer. I would say over the last 5 years, we've seen tremendous advances. And as you've said, these are our three go-to companies and products that we use on a daily basis in the clinic with great success. Yeah.
So I want to pose the question that's been asked to Dr. Haas, which is really around this whole concept, really both Liz and Dr. Haas, because we're talking a lot about the K2 and D3, and our great friend, Dr. Alan Reisinger on the MD side, give him kudos for MD VIP, is asking some intricate questions. So I want to pose those questions. I know you posted in the chat, but you answered the first one, but I want to bring it up just to make sure that everyone does hear that. And so he was asking, let me go all the way back up. You guys answered a lot in here. That first question, which was the beneficial effect of adding the D3 and K2 to your products to be systemic from that buccal absorption, or is it more of a direct topical effect on the dentition?
Yeah, there were a couple of questions about D and K2, so I'll kind of maybe, if you don't mind, quickly go through all of them. So yeah, as we all know, we need more vitamin D as a society in general, because we all live indoors. We need more vitamin K2 because of the changes in our food and processed foods, etc. And without those two vitamins, we just cannot absorb enough calcium in our teeth and in our bones. And so we've included them, and we have a patent pending formulation called hydroxamine, which is any version of hydroxyapatite. And again, it's really hard for me to, when I ask audiences, usually like only 10% of dentists even have or have heard of hydroxyapatite as an ingredient in toothpaste or mouthwash, but it's one of those ingredients that we love to use. We use the nano version of it, even though micro is fine, but I prefer nano because it mimics enamel. It has many other benefits. Chlorhexidine, it actually sticks to bacteria, reduces plaque. sometimes similar to chlorhexidine with zero toxicity, just like our friend Liz was also saying. And so there's a lot of benefit to this. But going back to vitamin D and K2, calcium, hydroxyapatite is just a calcium, right? It's a calcium phosphate. And so because we know that almost everybody is deficient in these two vitamins, we've included in every toothpaste we have, we call it hydroxamine. Hydroxamine is hydroxyapatite plus vitamin K2 and D3. In toothpaste, in every toothpaste we have, in every mouthwash we have, we've also included in every floss we have, because that's where we get most of the cavities. Of course, at this point, we know that the effects are for sure systemic through the absorption through the mucosal tissues, the soft tissues in the mouth. We also swallow a whole bunch of toothpaste and mouthwash. The younger you are, the more you swallow. The average is about 30%, especially when you're a younger person, you just swallow more of it. So you get some of that vitamin D and K2. The levels that we use, it's even at the daily allowance, which is kind of like what we use a little bit. I mean, depends on how much toothpaste you use and how much of it you actually swallow, but that's approximate. I was just mentioning in that chat that you will have to eat 7 tubes of our toothpaste to get to a level of toxicity of vitamin D. But that's if we didn't have any vitamin K2 in it. And so I don't know if you heard, but like a couple of weeks ago, there was a gentleman who actually passed away in the US. He was taking 60,000 units of vitamin D every day. Did you guys hear that? I don't know, it was on the news. And because what happens if you take vitamin D without K2, vitamin D just gets the calcium and puts it in the blood, but doesn't activate the proteins to take it from the blood and put it in the teeth and the bone. So vitamin K2, I think, is the missing part that a lot of people don't take along with vitamin D, which not only negates that toxicity potentially, but also it's a piece of the puzzle that we needed regardless. So that's one of the reasons we use it and we love it and we use it in all of our products.
And Liz, that's really the same for you guys. I mean, I think the science is just speaking why these products and synergistically they can work together, right? Anything you'd like to add about the K2, D3? Because I know it's pretty important when we're talking, especially with implant failures, of how you ended.
Right. So we have the K2 in our formulation as well. And we do need the other micronutrients, the other antioxidants. And so many times with supplements, they don't get absorbed at all. And that's really challenging when we're trying to find a good vitamin supplement. And I've been taking mega doses of vitamins since I took biochem, which is now called cellular molecular biology, back when I was in college, and have been a believer ever since. But it's not enough just to take, you have to really make sure that whatever you're taking is balanced. It's not going to be harmful, and it is going to be absorbed so it does its job. So with the Dentamedica, it has been tested, of course, for the vitamin D levels with blood testing, but also a biophotonic scanner to make sure that the antioxidants are being absorbed and it's not just all going into the sewage system, basically. But you need to have that balance with the K2 and the D, absolutely.
And then somebody asked me how to use these products together. Are these your core 3? And I can't say it loud enough. Yes, yes, and yes. Dr. Pritchard, you can speak to that. And I think it's really understanding, like I'm going to say, when do I veer to Stella Life is, do I need healing? Did they have surgery, right? Did they have a major issue like we're talking about that we need to deal with that issue? Do I need an analgesic effect, right? And I'm not going to get that from Supermouth when somebody's coming out of an implant or an extraction, or like she showed a bone graft. But do I want to put in, I'm going to say, some horrible toothpaste with my Stella Life? No, I want to make sure, just what he's talking about, that I'm giving the things to support that Stella Life and the prebiotics and all that is working synergistically in the mouth together. And so again, we're choosing that right product. And then the same with the probiotics. You know, if I have a high count red complex, I'm always going to err to the Probiora. But many patients don't have those, especially in our implant failures, Liz. We see more and more of these orange zones and strep strains. And so that's where Stella Life's probiotic is going to shine. So again, that's why we're testing, right? How does that patient present? Do I need a lot of healing or not? And then which is the best target to get them to what we say, how you're seeing And then where do we go from maintenance? What I love about Supermouth is that it's that underlying product that's universal, right? Most people want to say, what can I use? You know, I can use Cell Life, I can use Probiora, and I can use these probiotics, but like I like a bunch of toothpaste and it's mouth spray, and I, you know, maybe have some bad breath and I want to use it during the day. So I want you to start thinking outside the box, and start having these core products to show you that, right, you can get some amazing outcomes when you learn how to use that based on the procedure and your test. I know it's a long answer, but Dr. Wilkerson,
Well, and
Dr.
it's also, isn't it so important that we're learning tonight that we may be very proactive in things like using a probiotic, but we don't really talk too much about what toothpaste you're using. And so I love the analogy that, you know, when we're talking about skincare, we're thinking about cellular response and health and hydration and things like that. When we talk about the mouth, it's almost like we're talking about a toilet bowl, you know, trying to kill everything. And it's like just, you know, knock it out. But we've been trained that way
That's
through
right.
the years of kill 99% of what? The germs. So we think of bacteria not as our friends, but generally as our enemy, and not what helps us to be healthy. So I love this conversation. Thank you all so much. And Cami, I can't even imagine how much money you've spent putting your together and your videos and your books, but you know, that shows your commitment. And I
Thank you.
appreciate that, as well as the research at Stella Life and Probiora. It's really amazing. The background on Probiora is very interesting with Dr. Sokransky at Harvard, who for more than 30 years was the most famous oral microbiologist in the world. And he was trying to find a vaccine for the mouth. They were able to isolate these wonderful three strains of strep that were very effective in raising pH and combating, you know, things like mutans. But I do want to mention, Deb, that Dr. Hillman, you mentioned Harvard, but he also was at the University of Florida on the faculty there at
Oh,
the Day
right.
School. And so we like to refer to, as a Gator, we like to refer to Harvard as the University of Florida of the North.
Thank you, Whit, for the understanding.
Yeah.
Correction.
In the future, let's keep Florida first.
And
What
Deb,
other discussion?
I'd like her to answer. There is a question. I was trying to type it in the chat, but just maybe address you and Liz, kind of go back and forth instead of me answering it. You guys are the specialists, because we know certain strains are certain places. It's not that the claims are false. So I kind of wanted to air that out. The question is, in here, a probiota represent a claim that they're the only one offering with bacteria specifically for the mouth. And then so it seems like Stella Life does have probiotics that are anti-caries and anti-gingivitis. So I assume these claims are false. Like, they're confused, right? And so I feel like we confuse our audience. I want to unconfuse them a little bit on that, and just the research around that, what we're saying. And so my lead always is certain strains target certain things and certain other
Right.
strains, and that's what we're trying to teach. But I do want to say, just on a caries level, just to clear the air, they all work on strep strains. They're all amazing. So if you're looking for that, I want to check that box off on both products. You can't go wrong.
Right.
And then you guys can get into the debate. Deb, I'll have you lead that off, since you're the one who kind of showed that and said that for the mouth. I think they're kind of misunderstanding, describe the mouth, because it's really
I think the way that I'm sorry, Laura. I think the way that I should have interjected that in the beginning, and Liz, no offense, and I'm glad you didn't
Not
take
at
any
all. No,
offense. I
yes.
think it's just, we have to enlighten folks as to the strains that are in these products, and not target a company as much as we target the strains and what their purpose is and what their beneficial design is for. So ours were rooted from the mouth and for the mouth, specifically targeting tooth and gum health. So if you asked, do we do anything for tonsil health? The answer, back of the throat, salivary glands, yes. but it's only because we're rebalancing the pH. We don't target that area specifically. So it's not, it's something that you would add. And I, I get called out, from a company perspective sometimes, but it is the truth. And I'd rather stand on our truths and know that we're synergistic. And Liz, there's something I want to add, but I'll let you go as well. But they are from the mouth, for the mouth, targeting tooth and gum health. And that's what I showed on that one slide, was when it comes to soft tissue, getting into the deep into the sulcus and into the gingival margins, we do that well. We coat tubules of the teeth. I don't hear anybody else saying that on the call. Not necessarily that it's bad. We just, that's why we're synergistic together. So anyhow, I hope that helps a little bit.
Yeah, I completely agree, and that's why I think there is a place, and I'm actually quite excited, about the ProBiora. But I wanted to just, if I could, just share a slide that so I can show you just the different strains, an expanded slide here that we see in the Stella Life, the gut and the oral, because it's the package has both together. So the
Yes.
oral will be also available as standalone product, but they have very specific functions, these different strains, and that's why they were selected, so that we can have that overall effect. But yes, it's a different approach, and they are different strains with different functions. And that's why I think that there is a place for both. I think we all agree on that, depending on the patient's needs. And so that's what we try to provide. And I think the most important thing for everybody is to just make sure we're doing something to help these bacteria out and to help the probiotics exist, and provide that environment so we can disinfect. And again, with some of the things we're using for disinfecting have had such a terrible deleterious effect on the microbiome, but we want something that's going to nurture that, which we're finding we're doing that with the Stella Life rinses, but then we can also give them the microorganisms to really have that nice, healthy microbiome. That's really what our goal is. And so, yeah, I just think that there's a place for both. Absolutely. And I think having what we're doing with this organization and with AOSH, and I think all of us on this call, is we're looking at all the things that we need to do to help our patient with, and customizing it. We can't use one approach for everybody because everybody is different, and not one thing is going to work for all people. So we need to find, and based on testing the, you can test the microbiome as well. I've had that testing done with my functional medicine doctor, testing the saliva, testing the blood levels of D. We need to be able to do that or get access to those tests if we're really going to provide intelligent treatment that is going to be most effective. So I think the customization of that based on the testing, and a more detailed health history that includes risk factors from the family, the parents and grandparents, all of these things must be part of our intake and our ongoing conversation with the patients, and allowing them to understand these connections, because that's
Liz,
why
I have an anecdotal.
Please go ahead.
No. Please, Liz, finish.
No, that's fine. Go ahead.
I wanted to give you some anecdotal props, right? So as much as we have the science, if it works in real life that backs up the sciences, right? You cross your fingers and just pray that the science is bared out in real life, right? So our marketing person in the company, she had orthognathic surgery, and it was a 7.5 hour procedure. You're going to learn about a dentist that I befriended not too long ago, last year, who's got that procedure down to like an hour and a half or under. It's pretty impressive. And he is the real deal. He's been filmed now and will be.
We're kind of losing you
At
there.
the symposium I mentioned in May. Diagnosed with colorectal. Oh, is this better? I'm sorry.
Yeah,
I'm going in and out. I think it's just weather related. I'm really, this night has been pulled off. Thank God. That's all I got to say. So at any rate, my sister was diagnosed with colorectal cancer as well. So I'm going to stick with the story about the orthognathic surgery. And I had her on our probiotics to kind of mitigate these sores and the pain from these lesions, but I had her on a Stella Life rinse almost immediately. And I have to tell you, the combination effect was just tremendous. And this this the orthognostic surgeon who did her procedure, when she went to see him, said, "What are you using?" And then she went through what I was talking to her about and what I put her on and recommended, and it was just amazing the the dissipation of the pain associated with it. It was still sore, but the pain was so mitigated. And then my sister's colorectal cancer that she was, stage 3 diagnosed with in 2022, late 2022, and just wakes up the first night after being infused in the bag and for 36 hours. And so she gets infused at this center and then leaves with a bag. And she wakes up the next morning, first treatment, and she's got all these sores that have already developed. So, of course, put her on a regimen of the rinse and as well, the gel as well for other like lesions and things that were occurring, and those kinds of things. But anyhow, on the Probiora, and I just have to tell you that my faith in everything is come full circle, and I believe so much on this anecdotal stuff. So thank you so much. I appreciate it.
Yeah, thank you. Thank you for your comments. And it's true. I mean, there's science, but what really works in everyday life? We have these
Yeah.
studies, and how can we get our patients excited and giving them something that they see a result, they get comfort, that makes all the difference, or like a beautiful package with the tooth care product by age makes such terrific sense.
Mhm.
And I think that's just spectacular. And so again, it's about customizing what people really need and what's appropriate for each age. So yeah,
Yeah.
that's exciting stuff.
Yeah. I just wanted to share that with everyone.
Thank
We
you.
have 2 other questions I want to get to, and then we'll start wrapping that up. I think the other question was directed towards you, Dr. Haas, on talking about the different types of hydroxyapatite
Hydroxyapatite.
and nano.
Yeah,
That's a hot topic.
I was surprised it took this long to bring up the topic of hydroxyapatite. That's usually the first one. All right, so let's talk about hydroxyapatite. So hydroxyapatite is a calcium phosphate, the building block of our teeth, obviously 97% of enamel, 70% of dentin. It's nothing new. It's been around since early 1970s, invented by the United States. But it became popular, unfortunately, abroad because of the cost. And so fluoride took its place, and fluoride is so cheap. Just to give you an idea of what the cost difference is, nanohydroxyapatite, which is the more expensive version of hydroxyapatite, I'll just explain it quickly what that is. But that's like in our toothpaste, 60% of the cost of our toothpaste is that one ingredient. It's nanohydroxyapatite. The other 40% is all the other ingredients plus the tubing and the packaging. Just to give you an idea why the cost of this, but you get what you pay for. It's a really, really an amazing ingredient. All right, so let's talk about it. So 1970s, hydroxyapatite was invented by the United States as an ingredient in toothpaste. It's literally the same calcium phosphate that's in your enamel. It was just a lot larger. So it's good. Any hydroxyapatite is good. But in 1980s, about 10 years later, in Japan, they created nanohydroxyapatite, which is about 1,000 times smaller. There's just micro variations between these. I shouldn't have used that word because microhydroxyapatite is really hydroxyapatite. When you hear hydroxyapatite, they mean the original version, the older version, which is the good version. But the better version, or the best version, in my opinion, is the nanohydroxyapatite. It's not just my opinion, by the way. There's been many, many studies that showed nanohydroxyapatite has a few extra benefits because it's so small. It penetrates the enamel, the nooks and crannies better. It sticks to microbes and reduces plaque without destroying the oral microbiome. It naturally whitens the teeth. It naturally reduces sensitivity. It remineralizes enamel. It buffers enamel against acidic attacks. So it's a really incredible ingredient. It's only a little bit more expensive. So companies like ours that we use nanohydroxyapatite, our products are slightly more expensive. That's one of the downsides of nanohydroxyapatite. But again, You get a $15 toothpaste versus a $12 toothpaste, but it's still, you know, if you want to make it work, I'd rather get a good one. They're both incredibly safe. They've been around for only 40 to 50 years. They've been tested and tested and tested and tested and tested around the world. So there's nothing new about it. What makes ours unique was that vitamin K2 and D3 that we've added. The only other thing I was going to add about hydroxyapatite is because it's so expensive, especially in nanohydroxyapatite, a lot of manufacturers, and because it's a new thing, and we do some social media advertising, and we've seen an explosion of searches on hydroxyapatite now for toothpaste. And so a lot of companies have started to include it, but what they do, either they use the cheaper version, i.e. micro or the regular one, or they use 1 or 2% of it just to say we have it. But almost every study out there that shows that it's, if you want it to be effective in remineralization, they've compared it at 10% to fluoride. And that level is as good or better in remineralization of enamel. Fluoride has one benefit, by the way, it makes your teeth stronger, but it has all those toxicity potentially, and that's what hydroxyapatite doesn't. But so you want to make sure that it's any hydroxyapatite, you should have it in toothpaste and mouthwash. But if you want the better one, is nano, and make sure you get the right concentration.
Awesome. Thank you for that. Yeah, I was waiting. I know that was usually one of the first ones out of the gate. So thank you for that question. And then Dr. Gina, we have a question about probiotics because it has to do with the gut here. And so when it comes to the gut, diversity of a good microbes is key, asked correct, which we'll agree. And so would the same be true of oral probiotics? In other words, and I feel like those are two different questions. So I'd like you to answer each one. Is it true for oral probiotics? And then is it good to like rotate, how we talk about rotating with the GI?
Yeah, so I would say first to just take a step back that the biome or microorganism environment, microbiome of the mouth, really the back of the throat somewhat, but then the esophagus, the stomach, the large intestine, the small intestine is different. Even the nose is different. So what is healthiest to live there together is a different set of microorganisms in an ideal situation. So what's good for the gut is not necessarily good for the mouth in terms of specific probiotics and in terms of rotating probiotics and in terms of the amount of the dosing, if you will. So it's one system, but yet the biome has a different makeup. That's how I would describe that in the various segments, particularly when we're talking about tongue to tail in the various segments of the GI tract, starting with the mouth, very different than the GI. So the answer as to what to do is longer than we actually have time for. But to answer your question about the oral probiotics, I'll acquiesce to Laura because it's definitely her area of expertise.
Well, I think the first thing, and then we're going to wrap up. This is the last question, is that the mouth is the opposite of the gut. In the gut, you want lots of diversity. So you want lots of strains. The mouth, and this is study after study, health does not have wide diversity. Disease in the mouth, periodontal disease, has lots of diversity. So we have to understand that. People are very backwards on that because they think it's the same as the gut, and it is not. If you have a lot of diversity in the mouth, so if you're running like a whole genome, right, and you have tons of diversity, it's actually not good. We have lower structured species, the healthy commensals, and we want a lot of them. So the number, the quantity, but we want high quality at a low number. And so then what I want to say to people is you need to clear. If you have red zone, you need to target red zone and clear it. Once you have that clear, that's actually how I use these two products, is once I get to that sweet spot, the expectation I want to be at, I'm going to use that product. And then a lot of times I will rotate them like you asked, because once I have good, then I do want two different species kind of going in there. We do have to remember L-reuteri is from mother's milk. There are benefits. So if I'm working on periodontal disease and certain red zones, I'm going to use that Probiora. Once I get there, if I just have orange left, I will switch over and I'm going to use Stella Life. because now I'm targeting orange and I'm targeting those other species. If I'm just going after strep strains, I can use either product. So now I'm just asking, right, what's the easiest for the patient? What kit am I giving them? And that's how you start to put these protocols together. But that was a great question. So with Dr. Wilkerson, wrap us up, because we're going to be covering all this stuff at our symposium.
Yeah,
Here.
I think what I'm most impressed with is, first of all, I think this has been a great, engaging conversation and very practical. And that's what we want to do, is to really be practical on, I mean, we've got some tools tonight that can really help people. And that's very exciting. And I appreciate y'all so much, Deb and Liz and Cammie, for your contribution. And the reason that we want to partner with you is because we believe in you and what you're doing. And we talk to a lot of other people that would like to work with us, but we're not interested in many of them. But we will continue this conversation. I think we need to even have lots of time for discussion, perhaps, if we can build it into the symposium, because this is where you glean the real pearls that you can take home and use in an amazing way. So I hope you all will be with us in Knoxville on May 18th and 19th. I'm going to be honest with you right now, because we're all in this together. Our sign up has been kind of slow. And so if you have friends that you could invite to come, please do. And we'll let you use that study club discount of 10% for your friends. If you want to invite someone as your guest, then we'll let you use that as well for them. But it's going to be amazing. I'm so excited for the speakers, some of whom you've never met before, that are quite amazing. And then just the interaction that we're going to have throughout the time together with the folks that are on this call. And many of you have never met each other. And so I think the camaraderie and the being together is a rich experience for all of us that we value and missed during that time of COVID. So please do go ahead and get signed up and registered to come join us for the symposium, and we can all be there together and have an amazing experience. We were on the phone today with the Dean, Denise Cook from LMU, and she's thrilled to be hosting this event. And it's the first of its kind in a university setting. It's a big statement for their school to say that we believe that the mouth is connected to the rest of the body, and we're going to prove it by the way we teach our students and what we implement. And we see the next generation seeing this as central. So thank you all so much for your commitment and being on tonight, and for your commitment to your patients and to each other. And we look forward to being together next month. Now we're only 6 weeks away. Yeah. And so 6 weeks from now, we'll be together. So I hope every one of you will put that on your schedule and join us, because we'd love to see you there and be together.
Appreciate all of you.
Thank you very much.
Everyone. Have a
Thank
great
you,
night.
everyone.
Thank you, everybody. Thank
Have an
you.
awesome evening. Stay safe.
All the best.
Thanks.